It's long been believed that stress exacerbates a number of inflammatory skin diseases such as psoriasis, atopic dermatitis, rosacea, acne. It's hard to prove these with very well-controlled clinical studies because what is the control group? I mean, everybody says that they're under stress. It's very hard to have decent control groups. Also, of course, when you try to do an interventional study, say stress alleviation techniques to treat a disease or to treat a disease in combination with other therapies, what is the control group? A group that is having some sort of intervention knows they're having that intervention. The control group, of course, knows that they're not having the intervention. So it's very difficult to do a double-blind controlled study. Having said that, the overwhelming number of reports and studies indicate that most probably stress really does exacerbate a number of inflammatory skin diseases. The interesting thing is that now there are a number of pathways that have been identified that can help to explain it. And I want to talk just briefly about one of these pathways, which involves neuropeptides. It has been discovered in our laboratory, as well as in some other laboratories, that a number of neuropeptides, something called calcitonin gene-related peptide, and another thing called vasoactive intestinal polypeptide that most people know, along with something called pituitary adenylate cyclase activating peptide, closely related to VIP actually. All three of these, through various mechanisms, have been shown to be capable, at least in vitro experiments, to bias antigen presentation away from Th1 immunity towards Th2 or Th17 immunity. And this might, if these are released under conditions of stress, perhaps, in a way, this could explain some of the exacerbation that is seen in Th17-associated diseases with stress. I will also add that there is pretty good evidence that stress does cause an increase of some of these peptides in the skin and the blood, particularly CGRP, or calcitonin gene-related peptide, and it's been reported that in patients with psoriasis, both CGRP and VIP are elevated in the blood. Inflammatory skin diseases themselves cause stress, affect quality of life, cause depression, and so I certainly believe that the time has come to use stress alleviation techniques, at least for selected patients, and this should certainly be part of our armamentarium in the clinic.